Hello everyone, my name is Seung-Hyup Kim, Professor of Radiology and Urology at Seoul National University Hospital. In this session, I would like to share my experience of contrast-enhanced ultrasound of the prostate. This world map shows incidence of prostate cancer. The incidence is high in North America, Europe, and Australia, while it is low in Asia and Africa. An important fact is that prostate cancer is increasing fast, especially in Asia, and especially very fast in Korea. So the prostate cancer is an important health issue in these areas, including my country, Korea. What about diagnosis of prostate cancer? Prostate-specific antigen is the simplest and the most popular laboratory examinations, but has limitations in sensitivity and specificity. Imaging studies so far, including transrectal ultrasound and MRI, also has limitations, so still definite diagnosis of prostate cancer depends on systematic biopsies. Our goal is to detect maximum number of significant cancers with minimizing the detection of insignificant cancers, because there are evidences that active surveillance is better than aggressive treatment for the management of the insignificant prostate cancers. So the imaging that can show aggressiveness will be the ideal imaging study, and the contrast-enhanced ultrasound may have a value in the sense. In 1998, there was a presentation in RSNA regarding CEUS of the prostate by Dr. Robert Bree. At the time, contrast agent was Echogan, and they reported that contrast-enhanced Doppler was extremely useful in defining the sites of the cancer in many patients. This is the first presentation, as far as I know, regarding prostate CEUS. Following that report, there were numerous articles reporting the value of prostate CEUS. Most of them reported favorable results, like detecting more cancers and being cost-effective. Although a few papers reported negative results, most of the articles reported positively. Those studies tried to answer the following questions. Can prostate CEUS demonstrate prostate vascularity better? Can prostate CEUS detect more cancers? Can prostate CEUS detect more significant cancers? And how can we use prostate CEUS in the era of prostate MRI? Now let's think about the first question. Can prostate CEUS demonstrate prostate vascularity better? This is an article published in the year 2000, and the title was Initial Experience in Contrast-Enhanced Sonography of the Prostate, and it says that enhancement of the prostate can be seen on grayscale and Doppler sonographic images, and so may be useful for the selective enhancement of the malignant prostatic tissue. In 2001, this article showed that we can see enhancement of the normal prostate tissue in young, healthy volunteers. In this article, they used Sonazoid as a contrast agent, and it says that it improves the detection of normal human prostate vascular anatomy for both color and power Doppler ultrasound, so it might be useful in examination of patients with suspicious prostate cancer. These images were taken in our earlier experience using Levovist, the first-generation agent. In this patient, tumor lesion was on the right peripheral zone, and although there were severe blooming artifacts in both neurovascular bundle areas, this cancer area shows definitely increased signal. The second question was, can prostate CEUS detect more cancers? And many articles answered yes. This article in 2001 clearly reported that It improves the sensitivity for detection of malignant foci without substantial loss of specificity. This was a prostate cancer area showing enhancement. Another article in the same year reported value of 3D contrast-enhanced power Doppler ultrasound using level-based. This article said that on histology, all enhanced lesions contained prostate cancer tissue, but smaller lesions were not identified, and 3D contrast-enhanced power Doppler ultrasound has the potential to visualize lesions with increased microvascular density. This was an article published in Lancet in 2001, and it said that contrast-enhanced prostate ultrasound improved the detection of prostate cancer and may allow for limited targeted biopsies, less than 5, which reduced the cost and morbidity. So they said it may be cost-effective. There was a debate from other groups regarding the cost-effectiveness. This is an article published in 2007 using flash replenishment method for directed prostate biopsies. They used 2 vials of Definity mixed with 50 ml normal saline. Biopsy was done during infusion, and they mentioned that the vascular detail provided by microflow imaging allowed directed biopsy with increased detection of prostate cancer. In the same year, 2007, there was a prospective randomized trial comparing contrast-enhanced targeted biopsy and systematic biopsy. They compared SonoView enhanced ultrasound-directed 5-core biopsies and 10-core systematic biopsies, and the result was contrast-enhanced targeted biopsy with a reduced number of cores detected more cancers than systematic biopsy. In 2008, a European multicenter study reported similar results, and they claimed that this was the first step toward routine use of contrast-enhanced ultrasound for prostate cancer detection. The next question is, can contrast-enhanced prostate ultrasound detect more significant cancers without increasing the detection of insignificant cancers? This is a review article published in 2006. They said that there is a clear association between contrast enhancement in the prostate and the diagnosis of clinically significant cancer. They also said most published research has focused on developing a cost-effective strategy for improving the detection of prostate cancer, which means biopsy of less cost with increasing the detection of significant cancers. In this article in 2007, they compared enhanced targeted biopsy with conventional systematic biopsies, and they found that with contrast-enhanced targeted biopsy, the mean Gleason score was much higher than that of the systematic biopsy. It means that CEUS targeted biopsies detect more significant cancers than systematic biopsies. This was Gleason 9 cancer in this enhanced area. This article was published in 2008 using a contrast-specific sequence, cadence. They used SonoView and compared up to 5 cores contrast-enhanced targeted biopsies versus systematic biopsies, and reported that contrast-enhanced targeted biopsy detects more cancers. However, they did not find differences in the Gleason score between those 2 groups. Another study in 2010 in Korean Journal of Radiology. They used the same contrast agent and the same contrast-specific sequence as previous article. They compared the time intensity curves of the high-grade cancers, low-grade cancers, and non-malignant groups. And they reported that high-grade cancer has a different acceleration time and time to peak as compared to non-malignant lesions or low-grade cancer groups. So they concluded that this contrast-enhanced ultrasound targeted biopsy can detect more significant cancers. Our experience of contrast-enhanced ultrasound of the prostate is not extensive, but clear thing is that it is valuable in localizing and targeting the lesion in patients with negative systematic biopsies with persistently high PSA, like this example. This is a 55-year-old man with high PSA and negative first biopsy, and so we did contrast-enhanced ultrasound immediately before the second biopsy. We do not see any lesions in grayscale and power Doppler, but contrast-enhanced ultrasound well shows a small lesion of early enhancement. Targeted biopsy of this area was positive, and prostatectomy was done, and this area was exactly correlated with cancer area. Another patient with a similar high PSA and negative first biopsy, and contrast-enhanced ultrasound shows this area of increased enhancement. We can have information from time intensity curve as well. Another similar case, there is a focal enhancing lesion in this area, which is well correlated with MRI findings at T2-weighted imaging, diffusion-weighted imaging, and K-trans map of dynamic contrast enhancement. The last question is, how can we use prostate CEUS in the era of MRI? There has been a big advance in MRI techniques of the prostate. Basically, T2-weighted images and diffusion-weighted images with ADC mapping and dynamic contrast enhancement well demonstrate prostate cancer lesions, like in this case. T2-weighted imaging, diffusion-weighted imaging, and ADC map and dynamic contrast enhanced images, especially early phase enhancement, well show the extent of the tumor. So basically, role of prostate MRI is local staging, but nowadays the role is expanding to pre-biopsy localization and aggressiveness stratification like PIRAS, and also has a value in fusion with transrectal ultrasound images for targeted biopsy. Now the definite movement is from systematic biopsy to targeted biopsy. So contrast-enhanced ultrasound is one of important options for targeting. So regarding the contrast-enhanced ultrasound of the prostate, I think still the European Federation guidelines and recommendations are valid. It says that still too limited and not sufficiently confirmed in clinical practice and should still be considered a research topic, with hopes of improvements as new techniques are becoming available. Thank you for joining this session, and please email me if you have any questions.